I've been sent a number of questions as part of a class exercise by students at Nassau Community College in New York, which I'm going to try and reply to briefly in the form of this video blog. The first question is from Paula, who asks, could we accept that this virus will mildly affect many people, or social media made us go into a state of panic where it would be harder to accept that fact? Well, I certainly think we have to accept that this virus is likely to be endemic in human populations for a very long time to come, unless there is a safe, effective and affordable vaccine and an unprecedented degree of global cooperation to deliver it to a sufficient number of the world's population to achieve a degree of immunity that will make it impossible for the virus to go on reproducing itself and will ultimately cause it to go extinct in human populations. The only virus that we've successfully managed to deal with in that fashion is smallpox, although potentially we could do it for poliomyelitis and for measles if the political will and the international investment were available. I think our perceptions of the risks of the virus have been significantly skewed by both social media and mainstream media, and the focus on stories about deaths, the international league tables of death statistics, the human interest stories of the people who have died, the losses, the tragedies that have befallen individual families, and the issues around obviously care homes and so on. However, in all of that, we have rather lost sight of the fact that for 80% of the people who get this disease, they won't need to go near a hospital. They will get better in the community. Some of them might be quite ill, but they will get better. For others who go into hospital, most of them will come out alive. The actual risk of dying from this disease is very small. The population mortality risk, if you get it, the risk of dying is obviously a bit higher, but nevertheless most of that mortality is concentrated in relatively elderly people. For younger people like the students on this course, then the risk is really quite trivial. Catherine asks, why is society in more of a panic about the coronavirus than about HIV? Well, Catherine, maybe I've just lived a bit longer, but I mean, there was a huge panic in the 1980s about HIV, which prompted governments to do some quite extraordinary things. You had conservative governments who suddenly became very gay friendly, who became very concerned. In the UK we had government information commercials running on the television which certainly were attempting to generate a level of fear in the population that was quite comparable to some of the information commercials that have been running in the coronavirus. But ultimately we learned to live with HIV. There still isn't a vaccine for it, but there are reasonably effective treatments which are reasonably affordable. In the beginning it was very scary, a lot of people died. Today it's a kind of routine hazard that certain people live with in their lives. People live with AIDS, live rather than dying from it. Olivia asks if pandemics affect the way politicians are elected for the next voting cycle. What's probably the depressing response to that, Olivia, is that there isn't really any evidence of that. If we look, I can really only speak from the UK, but there's no evidence that the government management of the 1918 flu pandemic had any impact on subsequent elections. although possibly the economic hit that the country took at the end of World War I, which was aggravated by the 1918 pandemic, was a contributing factor in election results. There's no evidence of that for the 1957 or 1968 pandemics. I rather think that elections probably turn on other issues, although pandemics are maybe an index of government confidence. If people are losing trust in their government for other reasons, then a pandemic might give it a nudge in the same direction. But I doubt very much whether it's determinative. Sophia asks whether Americans are particularly averse to changing their lifestyles to protect everyone's health. I think that's probably true. I mean, the United States has always been reluctant to invest in public health. Some cities have notably New York, have a very long and distinguished tradition of public investment in public health services. But they have withered greatly over the last 30 or 40 years, and their political support has always been fragile. A lot of this goes on at the state level, so there's a great deal of variation depending upon the political culture of individual states. I'm not sure that Americans are necessarily more averse, but it's only this kind of individualism, the notion that perhaps public health services operate to protect and benefit the unworthy, the sort of implicit eugenicism that you see in a lot of American political rhetoric, particularly around social security, the notion of state welfare, the idea that a state might step in to create a floor below which no citizen should fall. Those certainly are distinctly alien to political cultures in very large parts of the United States. And I do think that is a challenge. I mean, we had significant reform in the 19th century because it became recognized that the health of the rich and the health of the poor were inextricably bound up. If you had an epidemic disease like cholera, the rich folks were just as much at risk. And that became a pretty powerful motive for improving cities, improving sanitation. I don't actually see the same sort of lever operating at the moment. The rich kind of tend to think they can buy treatment, and therefore they don't need to invest in prevention. Catherine asks whether the focus on animal-human cross-contamination in China, the so-called wet markets, which was notable early on, gave a false sense of security. I certainly think early on that people were quite fixated on the parallels with the first outbreak of SARS. I think one needs to be a little bit careful about how one characterizes the wet markets. I mean, wet markets are places where live produce is sold to people who, by and large, don't have refrigerators. So if you're going to have, if you're going to eat fish, if you're going to eat chicken, if you're going to eat rabbit, these have to be freshly slaughtered or under the environmental conditions in the cities in Asia. They will get contaminated, they will go off, and they will poison you. And the idea of shutting down the West market, these wet markets, is very much a piece of cultural hegemony by certain groups in the West, and I think we need to be quite careful about it. I don't think that it particularly created a false sense of security so much as a sense of this is very like a coronavirus that we've seen before. SARS-1 had these particular characteristics that allowed us to contain it quite easily, and there is no particular reason to think that SARS-2 would be any different. The Chinese government showed itself to be quite competent in handling the first SARS virus. Unfortunately, this one had different characteristics which made it much more difficult to contain, particularly the role of asymptomatic and pre-symptomatic transmission. SARS-1 was by and large just infectious when the symptoms appeared, so it was quite easy to isolate people. SARS-2, the infection is transmitted in the community for a couple of days at least before any symptoms appear, and that's a big challenge for contact tracing and isolation, which the Chinese took on with a considerable measure of success. Madison asks about people panic buying things like masks for which they have no use. Well, Madison, I think we've got to be careful about the issue of panic buying. I mean, what we found in the UK was that the supermarkets ran out of stock, not really because people were grossly overbuying, but people were raising their normal household purchases by 5 or 10% as insurance against spending time in quarantine. In fact, they were complying with government advice, they were preparing for the inevitable, but the supermarket supply chains just couldn't cope. Supermarkets in the UK no longer have stock rooms of any size. They rely on just-in-time delivery from remote warehouses, and the system simply couldn't keep up. What we had was, if you like a pre-Christmas level of shopping, but pre-Christmas the supermarkets are prepared for it and they have the stock in, they have the delivery systems geared up to replenish the stores more rapidly, and they had no warning that this was going to happen, and the result was empty shelves. And I think we learned something about the fragility of supermarket supply chains, but I don't think that I also think we learned something quite interesting culturally about the readiness of elites to both scientific and policy elites to dismiss the rationality of ordinary people. Particularly the science elite retreated immediately to the kind of deficit model that sociologists have been criticizing for the last 30 years or so, of assuming that the public was somehow deficient in rationality, were doing irrational things by going to the supermarket and buying lots of toilet roll. In practice, as I say, it was a very marginal shift in the shopping habits had caused the whole system to fall over. And I think there are some quite instructive things to learn from that, both about retail and about scientific elites. I mean, on the issue of do people have any use for these? The issue of masks is obviously a very contentious one. They're really of zero benefit in protecting you from acquiring infection. They may have a very small benefit in protecting other people if you are out there coughing and sneezing. On the other hand, you could say if you're out there coughing and sneezing, maybe you shouldn't be out there at all. And as a sociologist, I also want to think about what is the message that is sent by large-scale mask wearing or mask compulsion even. I mean, it really says every time you go outside your house it's risky, society is something to be afraid of, other people are something to be afraid of. Goffman talks about masks as participation shields. They're barriers to interaction. And I'm not sure that that's necessarily something that we should encourage.